essential bottleneck of the entire longevity industry. This is the number one, the most resourceful, powerful tool which will ensure further optimized development of the industry. This biomarker R&D landscape was produced by Aging Clinics Agency, again, open source report 1 year ago. In November, we're expecting the second edition, which will be much more extended and much more, let's say, precise. But how these biomarkers actually can be applied for longevity and science of longevity. As you know, 92% of drugs actually fails during clinical trials in traditional biotech industry, which is 10 times more simple compared with longevity industry, with aging research. By our projections, up to 99% of drugs will fail in case of aging research because the experimental platforms currently used, or let's say common to be used in aging research, they're absolutely outdated. They were created 50 years ago. They're not absolutely up to date for 2020. So therefore, as Kate also covered this, there shall be applied much more advanced, much more modern, sophisticated techniques for experimentation. They shall be tied to humans, not to mice, not to any other worms or yeast or whatever model organisms. It shall be about human longevity, human life extension, about human prevention of the disease, age-related disease. When we're talking about biomarkers of aging longevity, what in particular we are meaning? These are techniques, data science techniques, first of all, capable to assess current biological age of any given individual, and also to assess, to provide some preliminary, let's say, projection whether particular interventions or some particular, techniques or drugs or some kind of, maybe other more advanced treatments will be beneficial or vice versa, will provide negative impact on human body health and also, longevity projections. There are some projects which already now have some panels of biomarkers, but we are estimating that by 2022, there will be good enough sophisticated, fully structured panels of biomarkers of longevity. And this will actually ignite a lot of very tangible tools and leverages for multiple players, including, for example, investors. It's like, from my point of view, it's to invest in aging research now without being based on some evidence derived from mice that something extended life of mice or worms. This is much to play in casino for investors is much more safer rather than to invest into those products which are claiming providing some results being based on mice. Investors shall be ensured that they have at least some preliminary, some at least basic kind of evidence on humans. I'm not talking about that, making dangerous experiments on humans. I'm talking about applying much more advanced techniques for experimentation, where model organisms, human bodies, and virtual emulation of experiments, of trials is, created, combined together and empowered by artificial intelligence.